In order to administer a nebulized breathing treatment, you will need a physician's order, the patient's medical record, inhalation medication, saline for inhalation, a nebulizer disposable setup, and a nebulizer. Before you begin the treatment, wash your hands. Assemble the equipment and medication. To prevent an error, the label should be checked 3 times, as you would when dispensing any other medication. Greet and identify the patient and explain the procedure.
I am the doctor's medical assistant, and he wants me to start you on a nebulizer treatment.
Remove the nebulizer treatment cup from the setup and add the exact amount of medication ordered by the physician. The physician bases the amount of bronchodilator on the age and weight of the patient. Next, add 2 to 3 milliliters of saline for inhalation therapy to the cup that contains the medication. The bronchodilator must be mixed with saline before being administered to the patient. The top of the mouthpiece usually screws onto the bottom of the cup, providing a reservoir for the medication and saline. Gently mix. After the saline has been mixed, attach the T-piece to the top of the cup and position the mouthpiece firmly on one end of the T-piece. Attach one end of the tubing securely to the connector on the cup and the other end to the connector on the nebulizer machine. Ask the patient to put the mouthpiece in their mouth and make a seal with their lips without biting the mouthpiece. Instruct the patient to breathe normally during the treatment, occasionally taking a deep breath. An occasional deep breath will help deep lung tissue absorb the medication. When the patient is ready, turn the nebulizer on. The medication in the reservoir cup will become a fine mist to be inhaled by the patient, and you will notice a fine mist coming from the opposite end of the T-piece as the patient exhales. The treatment typically takes about 15 minutes. Before, during, and after the breathing treatment, take and record the patient's pulse. Most bronchodilators cause a slight increase in heart rate. Notify the physician if the increase is significant or if the patient has other symptoms such as dizziness. When the treatment is over and the medication cup is empty, turn the machine off and have the patient remove the mouthpiece. Disconnect the disposable treatment setup and dispose of all parts in a biohazard container. Properly put away the machine. To finish up, wash your hands and document the procedure, including the patient's pulse before, during, and after the treatment.